everyone, it's Philip here from Vet Education. Thanks so much for joining us today. So I want to take a few minutes to talk about nutritional support of dogs and cats with cancer. We know that patients of cancer of any type can be faced with several challenges in their illness, including the side effects related to the presence of having cancer, side effects of surgery and even possible complications of surgery such as infection or wound healing and so on, and also side effects of other treatments like chemotherapy and radiation therapy. And all of these challenges can result in dietary intake in some patients that is lower than normal for the patient, and it can also result in the patient losing weight. It can cause poor wound healing and loss of appetite as well. Now, the internet contains a lot of advice on dietary recommendations for both people and for animals with cancer. And despite the certainty with which many of the dietary recommendations in cancer are made, our actual knowledge of the ideal diet, special nutrients and supplements included, is actually quite small, with very little scientific evidence supporting many current popular recommendations. So what I thought we'd do is just make a short list of the recommendations that are actually being proven to be of benefit for the patient. And the first recommendation is that we need to ensure that the patient receives its daily caloric requirements. And this sounds pretty simple, and that we should feed enough food to maintain the patient's body weight, but there's some caveats associated with that. So for underweight patients, so patients in poor body condition, they should be fed sufficient calories to gain weight to an ideal body condition score. And if you're using a body condition score out of 9, we're looking at between 4 and 5 out of 9, so about 4.5 out of 9 would be considered ideal. For overweight patients, we need to encourage those patients to ideally lose weight until they reach that ideal body condition of about 4.5 out of 9. Weight gain above the ideal body condition score in both rodents and people is actually associated with worsened outcome and can exacerbate comorbidities such as arthritis and heart disease. So we don't want our cancer patients to have too much weight, but we don't want them to be underweight either. So that's the first thing, ensuring our patient receives its daily caloric requirements in an ideal body condition. The second thing I want to talk about is what we feed this patient. Okay, and the second thing that is really important is to feed a complete and balanced diet. And whilst many websites and books suggest or promote these so-called cancer diets, there's actually no evidence that any one diet is superior to another in managing patients with cancer, as long as the diet's complete and balanced and meets nutritional requirements of the patients. Pets with cancer can be fed commercial diets, home-cooked diets, or a combination of the two. I want to take a couple of seconds just to talk about home-cooked diets, because if home-cooked diets are fed, they need to be balanced and complete, and this can be a lot harder than it sounds. There's a great website called Balance IT. I've put a web address in the written text associated with this podcast. And that website contains a homemade pet food balancer which enables users to create homemade diets that are nutritionally complete and balanced. If we fail to ensure a homemade diet is balanced and complete, we can end up with nutrient excesses or deficiencies that may worsen a pet's prognosis, either through cancer-related or nutritional-related effects. The second point I want to talk about is raw food diets, because some sources recommend raw food diets with pets in cancer. And it's very important that we don't do this. We want to avoid feeding raw food diets or treats to pets with cancer for a number of reasons. And the first is that raw meat, eggs, and unpasteurized milk carry a high risk of bacterial contamination with bacteria like Salmonella, Listeria, E. coli, Campylobacter, and many other potentially dangerous bacteria. Even freezing or freeze-drying raw foods do not make them safe, as many bacteria and the toxins that they make will survive the freezing process. And this is really important, particularly in cancer patients, because patients with cancer are frequently immune compromised. So patients undergoing surgery, chemotherapy, and radiation therapy often have increased stress on their immune system, making them more likely to contract infection than a healthy pet. In addition, if you have a patient on chemotherapy, chemotherapy agents themselves often actively suppress the immune system, making infection with bacteria even more likely. So again, just to repeat, it's really important that we don't feed raw food diets as any part of the diet to a patient with cancer. Now, let's switch tack a little bit and talk about low carbohydrate diets, because low carbohydrate diets have been recommended because in theory, if we deprive cancer cells of carbohydrates, we'll deprive them of the main source of energy. And while this has been proven in laboratory studies on cancer cells, if you deprive them of carbohydrates, these cancer cells die, there's currently no evidence that low-carb diets improve survival or cancer remission in clinical studies in dogs or cats. Similarly, there's also no proof to support the notion that grains are worse for cancer than other sources of carbohydrates as well. So going to a grain-free diet is not necessary at all in these patients. What about dietary supplements? Well, most dietary supplements available on the market have not been proven effective in the management of cancer in dogs and cats. In addition, dietary supplements vary quite widely in their concentrations, their bioavailability, that is the amount of that nutrient that's actually able to be absorbed and may be made available to that patient in circulation. And they also vary in the sorts of additives that they add to supplements as well, making selection of these dietary supplements fraught with inaccuracy. So omega-3 fatty acids, let's talk about those for a couple of minutes. The omega-3 fatty acids from fish oil may be helpful for animals with cancer, although there are only a few peer-reviewed studies on the benefits in dogs and cats at present. Now, whereas some high-quality commercial pet foods can actually contain enough omega-3 fatty acids from fish oil that giving additional supplements may not be necessary, other foods may not. So if you're adding fish oil to a patient with lower omega-3 fatty acid concentrations, just be sure to use a supplement that's been independently tested for quality control. Additionally, just be mindful of the fact that omega-3 fatty acids from plant-based sources do not have the same effect as those from fish oil. Again, also remember that fatty acids contain calories, as many as 10 calories per gram, meaning the diet you supplement with fish oil may need to be fed in smaller amounts to avoid unwanted weight gain in your patient. What about antioxidants? Well, antioxidant supplementation in food fed to cancer patients is controversial, as they may reduce the efficacy of treatments like radiation therapy and chemotherapy on cancer cells, because a lot of these treatments, both radiation therapy and cancer chemotherapy, a lot of them rely on the fact that we can oxidize and damage cancer cells. If we give antioxidants to our cancer cells, we can potentially make them a little more resistant to those treatments. It does appear, however, that supplementing antioxidants from food such as fruits and vegetables may be reasonably safe, but be sure to avoid foods that are toxic to dogs and cats, such as grapes, raisins, onions, garlics, chives and macadamia nuts and so on. So what does all this mean? Well, the diagnosis of cancer in a dog or cat does not necessarily necessitate a change in diet. As long as we meet the caloric requirements of our patient, the patient's fed a complete and balanced diet, and the patient has ideal body conditions, other changes at this particular point in time are generally thought not to be required. It's really important to avoid feeding raw foods, as many cancer patients are immune compromised and may develop really severe illness with these foods. If you're feeding home-cooked diets, it's essential these diets be assessed either by a board-certified veterinary nutritionist or by using a web-based calculator to avoid unwanted deficiencies or excesses in the diet. In the written transcript of this podcast is a list of helpful websites regarding nutritional supplements included, so take some time to have a look through those, particularly if you're using a homemade diet. Thank you very much everyone for listening in today. Hopefully that information has been helpful. We're actually in the process now of preparing for our upcoming oncology in small animal practice course for veterinary nurses and technicians. If you want some more information, take the time to visit our website, veteducation.com.au. Check out the veterinary nurse and technicians course page. There's a whole bunch of information there on that course. Thanks again, and we'll see you next time. Cheers.